Not lasting long enough in bed is something many men struggle with, but few feel comfortable talking about. It can feel embarrassing, frustrating, and even isolating, especially when it starts affecting your relationship or self-confidence. As a urologist and pelvic surgeon, I can tell you that this issue is far more common than most people realize. Nearly 1 in 3 men experience premature ejaculations, PE, at some point in their lives. It's a condition defined not just by how quickly ejaculation happens, typically within 1 to 2 minutes of penetration, but by whether it causes distress to you or your partner. In truth, the goal of sex should never be measured solely in minutes. It's about mutual satisfaction, intimacy, and connection. But when performance anxiety, physical sensitivity, or underlying muscle tension make that goal difficult to reach, it becomes a real medical concern worth addressing. When I first begin talking to patients about premature ejaculation, one of the first things I remind them is that it's not their fault. And it's not all in their head. There are many contributing factors that can affect timing, ranging from biological to psychological to relationship-based. Some men have heightened penile sensitivity or neurotransmitter imbalances in the brain that make arousal build too quickly. Others develop premature ejaculation due to anxiety, stress, or learned patterns over time, perhaps because early sexual experiences trained their body to reach climax quickly. Whatever the cause, the important message is that PE is treatable, and lasting longer in bed isn't an impossible dream. It's about understanding how the body works and retraining the systems that control arousal and ejaculation. For years, men have been told to rely on simple techniques like the stop-start or O-squeeze methods to improve control. These behavioral techniques can be very effective for some people. The stop-start method involves pausing stimulation just before climax, waiting for arousal to subside, and then resuming, gradually training the body to last longer. The squeeze technique adds gentle pressure just below the head of the penis during those pauses, helping reduce the sensation and reset the body's arousal threshold. Both techniques, when practiced consistently, can improve awareness of one's body and control over ejaculation. However, they often require patience, communication, and a supportive partner. And for many men, especially those struggling with anxiety or muscle tension, these methods alone may not be enough. In recent years, growing research has explored how exercise, breathing, and relaxation can play a role in sexual control. For example, diaphragmatic breathing, a deep, slow style of breathing that activates the parasympathetic nervous system, helps the body shift from fight or flight to rest and digest. This shift naturally lowers arousal intensity and allows men to stay more relaxed and focused during intimacy. High-intensity interval training, yoga, and running have also been shown to help by reducing overall stress levels and improving body awareness. These activities build resilience in the nervous system, teaching your body to regulate itself under pressure, including during sexual activity. However, there's one area of male sexual health that often gets misunderstood, and that's the role of the pelvic floor muscles. Many men have heard that Kegel exercises, which strengthen the pelvic floor, can help improve endurance and performance. While that's true in some cases, especially for erectile dysfunction or urinary control, it's not always helpful for men struggling with premature ejaculation. In fact, in many cases, it can make things worse. That's why I invited my colleague, Dr. Eric Leckie, a pelvic floor physical therapist, to share his insights. Eric not only specializes in men's pelvic health, but has also experienced premature ejaculation firsthand. When he first began addressing his own challenges, he believed that performing endless Kegels, contracting and strengthening those deep pelvic muscles, would help him last longer. But what he discovered was the opposite. Overtraining those muscles made his symptoms worse. The reason lies in something called pelvic floor hypertonicity, a condition where the pelvic muscles become too tight. When the pelvic floor is hypertonic, those muscles are essentially stuck in a contracted state. Imagine trying to take deep breaths with your abs permanently flexed. There's no flexibility, no relaxation, and no ability to respond dynamically. During arousal or stress, these already tight muscles can clamp down even more, creating tension and triggering rapid ejaculation. To put it simply, instead of learning to hold it in, men with tight pelvic floors often need to learn how to let go. Stress plays a huge role in this cycle. During sex, especially for men who are anxious about finishing too soon, the body releases cortisol, a stress hormone that increases tension throughout the body. The pelvic muscles, already tight, respond by contracting harder. It becomes a feedback loop of tension and anxiety that ends in frustration. That's why relaxation and muscle release, rather than strengthening, can be a game changer for men dealing with PE. Dr. Leckie emphasizes that the key is not just physical stretching, But neuromuscular retraining, teaching the pelvic floor and the brain to stay calm and coordinated during arousal, this involves specific exercises that focus on relaxation, flexibility, and mindful breathing. These aren't quick fixes, they require practice and consistency. But when done correctly, they can dramatically improve endurance, comfort, and confidence. To begin, men can start with gentle pelvic floor stretches that release tension in the hips, inner thighs, and groin, areas closely connected to the pelvic floor. The goal isn't to push or strain, but to breathe deeply and allow the muscles to loosen naturally. Exercises like stirring the pot, knees to chest, and happy baby poses, which Dr. Leckie often recommends, are designed to do just that. Holding each stretch for about a minute while maintaining steady, deep breathing encourages relaxation rather than contraction. Over time, this routine can recondition the pelvic floor to be more balanced and responsive, helping the body maintain better control during sexual activity. In my practice, I often tell patients that improving sexual stamina isn't about brute strength, it's about control, awareness, and harmony between the body and mind. By focusing on relaxation, men can reduce overstimulation and anxiety, creating space for greater pleasure and connection with their partners. And that's where we'll continue in the next chapter, diving deeper into how these techniques work physiologically, how to apply them safely, and how to combine physical and mental strategies for long-term results. Premature ejaculation doesn't have to define your sex life. With the right approach, it can become an opportunity to understand your body better, strengthen intimacy, and reclaim confidence where it matters most. Now that you understand how premature ejaculation can be linked to pelvic floor tension and overactivation, it's time to explore the science behind control, what actually happens in your body when you learn to relax, and how this rewiring process helps you last longer in bed. Let's start with the nervous system. Every bodily function, from breathing and digestion to sexual arousal, is governed by two main branches: the sympathetic fight or flight, and the parasympathetic rest and digest systems. During arousal, both systems work together in a delicate dance. The parasympathetic system initiates and maintains erection, while the sympathetic system triggers ejaculation. When these two systems are balanced, a man can stay aroused without climaxing too early. But when the sympathetic system dominates, often due to anxiety, tension, or stress, it short-circuits this balance, pushing the body rapidly toward orgasm. This is where relaxation training comes in. By calming the nervous system, you can shift dominance back toward the parasympathetic side, the part that supports erection and relaxation, delaying ejaculation naturally. It's not about fighting arousal. It's about learning to stay in that pleasurable zone without tipping over the edge. Pelvic floor relaxation is one of the most direct ways to communicate with this system. The pelvic floor is rich in sensory nerves and directly connected to both the spine and the autonomic nervous system. When those muscles are tense, they send signals that reinforce the body stress response, accelerating ejaculation. But when they're relaxed, they send calming feedback, allowing you to stay in control. Eric Leckie explains it like this: your pelvic floor is the gateway between your mind and your body's sexual response. If you're clenching, your body interprets it as a sign of danger. But when you relax, you're telling your brain, it's safe to stay here, it's okay to enjoy this. And so, how do you retrain this system? It starts with awareness. Most men aren't conscious of what their pelvic floor is doing during arousal. They may feel tightness in the lower abdomen, buttocks, or even thighs without realizing those muscles are contributing to tension in the pelvic area. The first step is to develop sensitivity, to notice when you're tightening and learn to release it. Here's a simple exercise to begin with. Lie down comfortably on your back with your knees bent and feet flat on the floor. Take a deep breath, letting your belly rise. Imagine the breath traveling all the way down to your pelvis. As you exhale slowly, consciously soften the area around your perineum, of the space between your scrotum and anus. Feel it drop slightly or widen. That's your pelvic floor releasing. Repeat this for several minutes, focusing on the gentle rhythm of your breath. You can practice this daily, morning, night, or even during stressful moments. The goal isn't to force relaxation, but to allow it. Over time, your brain begins to associate deep breathing and pelvic release with calmness and control, both of which are essential during sex. Another powerful method is progressive muscle awareness. This involves tensing and then relaxing different muscle groups, starting from your feet and moving upward until you reach the pelvic area. When you reach your pelvis, focus on the subtle difference between contraction and release. Many men are surprised to realize how much they hold tension there even when they think they're relaxed. In addition to breathing and relaxation, posture plays a major role in pelvic health. Modern lifestyles, sitting for long hours, slouching, or wearing tight clothing can shorten and tighten the pelvic muscles. Incorporating mobility work like yoga or gentle hip stretches can make a significant difference. Poses like child's pose, happy baby, and deep squat, a malasana help open the hips and lengthen the pelvic floor. The more space these muscles have to move, the easier it becomes to control them during arousal. But control isn't purely physical. The brain plays a central role in regulating arousal and timing. Neurotransmitters like serotonin and dopamine influence how quickly sexual excitement builds. Low serotonin levels, for instance, are linked to faster ejaculation. This is why certain antidepressant medications known as SSRIs can be prescribed to delay climax. They increase serotonin availability and consequently extend the time to ejaculation. However, medications are not the only way to regulate these pathways. Mindfulness, meditation, and breathing techniques have also been shown to modulate serotonin and cortisol levels naturally, improving endurance and pleasure without side effects. One particularly effective technique is the 4-7-8 breathing pattern developed by Dr. Andrew Weil. It involves inhaling through your nose for 4 seconds, holding your breath for 7 seconds, exhaling slowly through your mouth for 8 seconds. Practicing this before and even during sexual activity can slow heart rate, lower anxiety, and help you stay centered in the moment, making it easier to recognize the point of no return and pull back before climax. Another layer to this training involves reframing your mental focus. Many men approach sex with a goal-oriented mindset, the aim being to perform or satisfy. This pressure activates the sympathetic nervous system, ironically making it harder to stay in control. The key is to shift from performance to presence. Focus on the sensations, the rhythm of your breathing, and your partner's connection. This mindfulness-based approach enhances awareness of arousal levels and helps you regulate them naturally. In my clinical experience, men who master relaxation and awareness often experience not only better control, but greater pleasure. When you're not anxious about finishing too soon, you can fully engage in the experience emotionally, mentally, and physically. To summarize, here are the pillars of retraining control. Activate the parasympathetic system through deep breathing and calm awareness. Relax the pelvic floor. Release tension rather than overcontract. Increase body awareness. Notice sensations before climax builds. Reframe your mindset. Focus on connection, not performance. Support your body through mobility, good posture, and healthy lifestyle habits. In the next chapter, we'll explore how to combine these techniques into a structured program, one that integrates breathing, stretching, and mindfulness to help you regain mastery over your body and sustain pleasure longer. We'll also discuss how to involve your partner in this process to build confidence, intimacy, and mutual satisfaction, because lasting longer isn't just about delay. It's about deeper connection, better control, and a more fulfilling sex life overall. Now that we understand the mechanics behind premature ejaculation and how relaxation retrains both your body and nervous system, it's time to put everything together into a practical, sustainable plan, one that helps you not only last longer, but also feel more confident, connected, and in control. The ultimate goal isn't just to fix premature ejaculation, it's to help you develop a healthier, more relaxed relationship with your body and your sexual experience. Let's start by acknowledging something important. Control doesn't happen overnight. Just like learning to play a musical instrument or mastering a new sport, it's a gradual process that requires practice, patience, and compassion for yourself. Many men put immense pressure on themselves to perform perfectly, and that anxiety becomes the very thing that triggers early ejaculation. So the first step toward improvement is letting go of perfection and focusing instead on progress. Every small gain, lasting a few seconds longer, feeling calmer, or staying more present is a victory that moves you closer to full control. A structured routine can make a huge difference. Think of it as training your body and mind the same way you might train your muscles at the gym. The foundation begins with daily relaxation and pelvic awareness exercises. Continue the breathing techniques we discussed earlier, deep, slow, mindful breaths that expand your abdomen and gently relax your pelvic floor. Practice them at least once or twice a day when you're not sexually aroused. Over time, this conditioning helps your brain associate calm breathing and pelvic release with control, making it easier to access that state naturally during intimacy. The next layer is sensate focus, a concept developed by Masters and Johnson, pioneers of modern sex therapy. This involves removing the pressure to perform and instead focusing entirely on the sensations of touch, warmth, and connection. Partners are encouraged to explore physical intimacy without the goal of orgasm. This method rewires the brain to stay grounded in the present moment, helping men reduce anxiety and recognize the subtle signs of arousal. Gradually, as comfort and awareness build, sexual activity can resume, but now with a heightened sense of control and confidence. Another key component is start, stop, and squeeze techniques, which have long been used to train ejaculation control. Here's how it works during stimulation. You or your partner pause just before climax and hold that point for several seconds, allowing the excitement to settle. You can combine this with deep breathing and pelvic floor relaxation to reinforce the sensation of control. Over time, your body learns to extend this plateau phase, giving you more time before reaching orgasm. The squeeze method adds gentle pressure just below the head of the penis to reduce stimulation. Both approaches, when done mindfully, can teach your body that arousal doesn't have to end immediately in ejaculation, that you have options and agency. While these techniques work physically, what often cements lasting improvement is emotional awareness. For many men, premature ejaculation is as much about the mind as it is about the body. Anxiety, performance fears, relationship stress, or even subconscious guilt can amplify the sympathetic nervous system, pushing the body to rush. Addressing these emotional layers, whether through self-reflection, journaling, or therapy, can dramatically improve results. Cognitive behavioral therapy, CBT, for example, helps reframe negative thought patterns about sex, replacing fear and pressure with calm confidence and self-compassion. Lifestyle also plays a critical role. Maintaining good cardiovascular health supports better erections and stamina. Regular exercise improves blood flow, boosts endorphins, and reduces stress hormones like cortisol. A balanced diet rich in omega-3 fatty acids, zinc, magnesium, and antioxidants supports testosterone production and nerve health. Limiting alcohol, quitting smoking, and managing sleep all further enhance sexual performance. Even small lifestyle changes, taking daily walks, practicing yoga, or cutting back on caffeine can make a tangible difference in control and confidence. Communication with your partner is another vital part of this journey. Many men struggle in silence, fearing embarrassment or disappointment, but the truth is that open, honest communication builds trust and reduces anxiety. When you can talk about what you're working on, your breathing, your focus, your progress, you turn the challenge into a shared experience rather than a solitary struggle. Involving your partner also helps set realistic expectations and builds emotional intimacy, which itself improves sexual connection. For some men, medical support can complement behavioral approaches. Prescription options like selective serotonin reuptake inhibitors, SSRIs, or topical anesthetic cream can help delay ejaculation in the short term while you develop natural control. But these should always be used under medical supervision and ideally as temporary aids rather than permanent solutions. In my practice, I often combine short-term medication with long-term behavioral therapy, allowing patients to build confidence as they gradually reduce reliance on medication. Another helpful approach is mindfulness meditation. Even 5 to 10 minutes a day of focusing on your breath or bodily sensations can help retrain your attention away from racing thoughts. Over time, mindfulness not only improves sexual control, but also enhances overall well-being, reduces anxiety, and increases emotional awareness. Studies have shown that men who practice mindfulness report longer latency times, improved satisfaction, and a deeper sense of connection with their partners. Ultimately, overcoming premature ejaculation isn't about eliminating arousal or suppressing pleasure. It's about harnessing it. By learning to understand and cooperate with your body rather than fight it, you build confidence that extends beyond the bedroom. You start to trust yourself again, to feel calm even in moments of excitement, and to recognize that control doesn't mean rigidity, it means balance. In closing, remember this. Premature ejaculation is one of the most common sexual concerns men face, but it's also one of the most treatable. Whether it's through pelvic relaxation, breathing, therapy, or lifestyle changes, you have the tools to retrain your body and reclaim your confidence. The journey requires patience, curiosity, and kindness toward yourself, but every step forward brings real progress. With consistency, communication, and compassion, you can move from frustration to fulfillment, not only improving your sexual performance, but deepening your emotional and physical connection with your partner. That's the true essence of lasting control, not just lasting longer, but living fuller, calmer, and more connected to yourself and those you love.